Welcome to the next installment of the healthcare series of the Power Eastern Oregon podcast. I'm your host, Paige, Marketing and Community Relations Coordinator at otec, and today with us we have Tony Swart, Administrator and Vice President of St Alphonsus, Eastern Oregon. Welcome.
Thanks, Paige.
Yeah.
Good to see you.
Good to see you. So I can't wait to get into some of the highlights and wins that St Alphonsus has to share with us today, but before we kick that off, let's do our safety share. It's time to start planning out your planting. Whether you're a farm operation or planting that garden bed, make sure to know where your power lines are. They can sag over time, so be sure to call us at otec if you notice suspiciously low-hanging lines, and always call 811 for a locate before you dig. So, Tony, tell us a little bit about yourself and then give us a springtime safety habit.
Sure. So, Tony Swart. I have been with the St Alphonsus organization here in Baker City since 2019. Prior to that, I worked for St Alphonsus in the Boise and Nampa market. So I've been with them since 2007 in various roles. I am originally from Enterprise, Oregon. Okay. So when an opportunity came available out here in Baker City, I grabbed it, and it's just been so great being back in Eastern Oregon and serving these communities. Rural healthcare is just a passion of mine, and I just been very blessed to be able to work with the team we have here, and then also form really good partnerships with places like otec and other partners we have in the community, and just been very fulfilling.
That's awesome.
Yeah, and let's see, a springtime safety habit. So I guess, like, personally, I would say is just kind of getting the house ready and prepared for the summer, and some of that spring cleaning, and getting my kids to help out with that. I have a daughter and son and my wife here that we're all like to spend time at the house and outside. At the hospital, we really do a good safety check for the facility, kind of around the exterior of the campus, interior, and we really are always kind of continually kind of in readiness mode for patient safety and colleague safety. So it's always top of mind, and a very much a value of our organization too.
Yeah, absolutely. And, as you're mentioning stuff around the house, it just kind of made me chuckle. We've got something similar happening at my house around this time of year. And we've got chickens and animals and inside animals and all that kind of stuff. So we're doing kind of the big heavy lifts before spring comes in, getting everything dusted down and sanitized and filters changed and everything sprayed off, and just really resetting before this nice spring weather comes, and we will feel way too excited about the sunshine to try to do anything indoors.
Yeah.
So you said you're from Enterprise, and welcome back home recently. Yeah. What local tradition or landmark around this area or near your hospital makes it really feel like home?
Yeah. So my wife and I, my wife's name is Anna. She works at the school district here actually, and is very involved in the community. But we're also very involved with our church here, St. Francis, the Catholic church here, and beautiful cathedral. And I think that landmark, I mean, obviously it's big. You can see it from all over town, and beautiful, and just a great group of people there. And I think that it does just make me feel like home. And like, what's great about it is St. Alphonsus is also a Catholic health ministry. And so I get to have that world as part of my working life too. And so it's a really kind of cool corollary that I get to have in my life. And then, I think that just the traditions of Baker County, that since we moved back, and the events are so much fun, and you can really see the community kind of rally together to have, Miners Jubilee and the other, Baker City downtown events. And so we love to be involved in those and see everybody there.
Yeah, that's awesome. There's nothing quite like when that sunshine comes in on those stained glass windows at the church. I mean, there are pictures online. Go and look it up. It is a beautiful cathedral. And like you said, you can see it from every part of town. So it's a pretty cool landmark for sure. So let's get into some of the community wins that you guys have. And I'm pretty excited for you to talk about sort of the intermediary care that you guys have been able to implement recently. But I would like for you to share with us what upgrades or improvements you're most proud of and how it's made care easier locally.
Yeah. So recently we've done some investment in our surgical services space. So our foundation has contributed a large sum of money to upgrade some equipment there to get us ready for a general surgeon who's coming. And so we're excited about that. We have a great team, surgical services, and They do a lot for us. So we have to continually reinvest in that program. It's
Absolutely
expensive equipment, but it's very much needed. I'd say, yep, our intermediate care unit allows us to keep higher acuity or complexity patients now instead of transferring. And so that's important. We want to be able to admit as many patients as we can to our facility and take care of them close to home. And so having that capability is important. And so those patients aren't having to go typically down to Boise to receive care and then come back. So that's a really big win. And I think just overall, we're really looking at kind of, I guess, refreshing the facade and the exterior of our hospital. So you guys will see that over the next probably 6 to 8 months. And it's an aging facility, but we've got to keep it up and running. So trying to do a lot of work there. So that's exciting.
Yeah, that's super exciting. I love to hear that you guys are able to kind of continually invest in that surgical side of things and keep that ball rolling on that side, so to speak. Yeah. I would love to hear a teamwork story from this past year that really sticks out in your mind.
Yeah. We occasionally will have really what we call surge events in our emergency room, and where it's just kind of an influx of patients. And, typically we staff one ER provider, a physician, and 2 nurses. And then we'll have some other resources around, obviously, to care for patients. But when we get that influx, it takes a village group approach just to manage that. And so just recently we had several very complex patients arrive back to back to back. And just to see our team manage that, triaging patients, it's like, people working in the ER will know this. I think they thrive in that environment, and they do such a great job. I mean, getting the patients in, seeing if they need to be transferred, but getting them cared for. It's really a sight to see it. And it makes you proud to see your team when they're functioning at such a high level. So,
yeah, absolutely. There's a reason that ER medical shows do so well. And it's because everyone loves to see, when rubber meets the road, you have to get that patient, that set of patients, in this case, cared for. And just seeing people operate, and not to, take away from actors on the screen, but if you've ever seen ER professionals work in real life, you're right. It's a sight to see. It is incredible, the level of care and dedication and tenacity they have. It's something that I'm always in awe of when I see in motion.
Well, then, and in the midst of a very high stress, high sense of urgency environment, they still keep their composure and their compassion. And so it's this personality that they are very, very cool people to work with. And totally. So I appreciate our team in the ER a lot.
Yeah, that's awesome. Yeah. Let's talk about a moment when the hospital and the community supported one another.
Yeah, we just had a foundation event, our gala, and very good outcome in terms of community support and attendance. And it was a lot of fun. And our foundation is kind of trying to reinvigorate that, different events to support and raise money for our foundation. So it was really great to see the community support there. When I first started my role out here, I think it was 2019, 2020, we partnered with the YMCA and a school district to help with some childcare solutions. And so that was a great partnership. There's a lot of needs in our community that really one agency can't really tackle on their own. And so I think it is important that we all work together. And then our partnership with OTEC and LESS is continuing to evolve. And what I talk about OTEC a lot when kind of engaging the community. And I really see OTEC as this kind of anchor institution in our community. It's interesting that an electric cooperative utility would have the outreach that you guys do. So it's so cool to see. And I talk about that a lot. I say, I want St. Al's to be that. I want us to be the hospital, but I also want us to partner with the community where we're reaching people in different ways too.
Yeah, so thank you. Thank you for that. It's definitely one of my favorite parts of my job, that I get to kind of, be the community relations coordinator and kind of get those partnerships really dialed in. And, rural communities exist by and for the people that live there. Yeah. And so, when you talk about your partnerships with the schools and, with OTEC and everything else, it makes complete sense to me because we all live here. We all want the best for the area. I think it's really, really important that maybe the people listening realize that your hospital isn't just a hospital. It's your neighbors. It's, your kid's soccer coach, whatever that may be. And, make sure that you take time to invest in the relationships with your providers. They're there to help you. And so I always tell my husband, I joke with him that when we lived outside of this area in a big city, it was really easy just to kind of brush off what my doctor said. But now that I'm in this area and I see my doctor every Monday at church practice or at choir practice, I mean, it's a little bit harder to be kind of dismissive of advice or something like that, because I really do respect my provider so much more. And maybe that's not necessarily a good thing, but I do now that I know their face and I know their family and we all live in this tight-knit community.
Yeah. And I couldn't agree more. I think, we all do encounter each other in our professional lives, but personal lives. And then, you'll see the same faces on boards that you volunteer on or sporting events or children's events. And, I think, for example, I think we have a good partnership and we've been trying to bring this partnership together more, but with like our city leaders and county government and county commissioners, because we're all kind of tackling some of the same issues. And sometimes those conversations are happening in silos. And if we can come together and convene together, I think that sometimes we can get some of these things changed or improved in our community. And what's great about our community, kind of going back to seeing everybody, is you might see somebody at the soccer game, you can have that conversation about work or whatever, but I love the tight-knit community. And so, partnerships both professionally but personally as well. So that's great.
Totally. And I love that you bring that up, because collaboration is one of the things that I'm most passionate about in my role and what role I play in our communities. And like you said, there are silos that exist and they don't have to. And Abe Lincoln, I think, said it best, a house divided. If the house is an issue that you're working on, you'll be a lot stronger if you're together. Yeah. So let's talk about innovation. Yeah. What innovation are you most excited about, either in the world at large or in healthcare specifically?
Yeah. So one thing that I see, and this is typical for rural, and we're actually considered a frontier community in the medical world, is we have a lot of patients who have to travel for care. And so, whether it's from, Wallowa, Union, Baker counties, Grant County, Harney County, that there are a lot of patients having to go to Treasure Valley, Boise area, or to Portland. And it's a burden. And it is amazing to me the amount of patients that are on I-84 on a daily basis traveling for care. Yeah. And so we're starting to see more impacts with telehealth and being able to serve these patients remotely. Yeah. And so, rather than having to travel the 2 hours, sometimes 4 hours for our communities into Boise, having them be able to see a provider remotely. And then, not just, on an iPad at home, but, kind of an integrated environment where it's still kind of the look and feel of a clinic visit, but you may just be seeing the provider remotely, but the rest of the team and the rest of the resources are there. So I think that that's an exciting opportunity and a way that St. Al's we can leverage our full specialty network to try and bring some more of that care here. Yeah. So that's a big conversation. And then, AI is always in the kind of the overall conversation with a lot of industry, but there's a lot of exciting things with AI in the healthcare space. Some of it is emerging. Some of it we've already implemented with, documentation or helping our physicians in their clinic practices, and using those as tools to better our patient care and our patient experience will be exciting to see how that kind of moves along in the future.
Yeah, I totally agree. And it's really, you can see the impacts, the positive impacts of technology on healthcare. If you're just keying into it when you go to your regular checkups or whatever, it's pretty amazing the documentation load that it takes off the providers to be able to have that face-to-face interaction without typing at a screen the entire time. So it's really cool the way that we're able to use a blended approach of technology and the human touch in healthcare.
Yeah.
Let's talk about how new tools open career paths or training opportunities for your staff at St. Al's.
Yeah. So healthcare is a space where, again, it's it's a rapid, technology advancement. And so in really every area, surgical space, specialties, like cardiology, there's a lot of innovation there, orthopedics, I mean, you name it. And even tools like clinical tools, new ways of practicing, I would say. So it's not necessarily equipment or technology, but new ways of practicing. And so really it allows for a lot of opportunity for training, because we need our existing clinicians and staff to be able to learn this new process or tool, but also we need to bring in new talent that is able to, that we're learning this maybe in grad school, and they're really more of an expert than a seasoned person. Yeah. And so I think it's anytime there's a new technology, it gives us an opportunity for increased training, new certifications, and really finding sometimes new roles within the hospital because we need it because of these new tools and advances. So it makes healthcare a fun space because you never really know what's on the horizon. Yeah. And so it's great. And whenever you can, help staff train and advance their careers, it's fulfilling every time too.
Absolutely. So, well, and to kind of take a more holistic approach, we've been talking a lot about your providers and your like direct care team, but there's a lot on the back end too, that these new technologies create job opportunities for like an IT specialist or, something along those lines. It's like the more technology we implement, the more we do need experts in the field to help manage that technology. Yeah. And so I think it's a really cool space, not just in healthcare, but in the world at large, that people realize that technology will always need humans.
Yeah, it's true.
And so, while it might gain efficiencies in one place, you're going to need somebody who can help manage that technology on the back end. Yeah. So it's pretty cool. Let's talk about some partnerships, which we've already kind of hit on earlier, but if there's any other examples that you'd like to give of partnerships that have made a meaningful difference.
Yeah, so one is Eastern Oregon Coordinated Care Organization, EOCCO, is a partner of ours, and they manage the Medicaid population in Eastern Oregon. They do so much in terms of services for our community and helping their members navigate healthcare, but also other aspects in their life in terms of different social and health determinants. And also they're strong advocates for healthcare. They're strong advocates for rural healthcare. And so that partnership is amazing. And interacting with their leadership and their staff, you can feel kind of their mission. Just it's very tangible. And we really need that in our rural communities. We have a fairly high Medicaid population that has needs that we need to serve. And so it's great to have that type of partner. A partnership with the YMCA has been pretty strong over the years, and anything from like the daycare that I talked about, the child care services that are always a need in this community and evolving, and it's a big deal. I think we should always keep that conversation going. Also, just kind of as a thought partner, like we try to have people that we talk to when we have a certain problem or solution, or issue that we need a solution on. And the YMCA has a good feel for our community. And so bringing their leadership into conversation has been good. And then, I mentioned our city and county government. They want so much for our community. Right. And it's very similar with healthcare. Like sometimes it takes such an act to just get something to change. Yes. But like, again, convening partners, I think is helpful to help overcome those challenges. And I've just found that our city and government leaders can help us with that. And they really do want the best for our community. So lots of partnerships. It's a big part of my job that I love too.
Yeah.
So
that's awesome. It makes total sense to me that you guys have a strong relationship with YMCA because the other part of health is wellness. And what better space to kind of look through for wellness than the local largest gym. And they offer so many programs and things like that. So it makes complete sense to me that they would have a good bead on our community and with all of the sports that they do for the youth and just all the different programs they have for young through aged is pretty incredible.
One other, I guess you'd call it a partnership, but it's really, so we're part of a larger, broader health system, St. Alphonsus Health System, obviously, that has, a footprint in Idaho and then Trinity Health nationally. And I think having the support of such a large organization, especially in a smaller rural environment in Baker City, it's a really big deal. And so I consider that a partnership because we're here locally driving, change and improvement at our hospital. But without that support, it would be very difficult. So that's an important thing for us too.
Yeah, definitely. So we're getting into the end of it here. Is there anything that you would like people to know that maybe they don't know about your hospital?
Well, yeah. So we have a very robust portfolio of services that, I think most people know, but, we have, for example, state-of-the-art imaging equipment. And again, as part of our system, we're blessed to be able to constantly renew and new equipment. And so whether that's MRI, CT, mammography, all that is great equipment. We have a cardiovascular pulmonary rehab program, and really we've invested a lot in the cardiology space in general over the years. And so that echocardiogram, we have a cardiology nurse practitioner that's with us now, and then outreach cardiologists who come. So that's a big deal. We have surgical ophthalmology, which is a new service. So Dr. Hansen is helping us with patients who have cataract surgery, and that's been a big win. I think surgical services, we really do offer a lot of services, and I think that, it's important that we share that with community so they know when they have a referral or from their primary care provider or are seeking specialty care that we can serve a lot of those needs here and to make it easier on our patients. And so I think it's that. And, if anybody in the community needs that information, we're happy to share it with, community groups or whatever. It's fun to get out and tell our story.
Yeah, absolutely. And so if people do want to find out more about those services, they can just go to your website?
Yeah, the website is good. And honestly, I love having visitors. So as much as my time allows. Yeah. And again, I like to go out and meet people too. So, getting hold of us at the hospital, it would be good. And we'd be happy to come out and talk to people. So
that's cool. Thank you so much for joining us today. And super excited to share the wins that St. Alphonsus has brought into the community. We didn't talk too much about it at the start here, but healthcare is one of the leading foundations of what makes a healthy community. And so the more that we can strengthen our partnerships within our community and keep healthcare strong here is always a win, in my opinion. And
yeah, I agree. Yeah, well, thanks for the invite. This has been a lot of fun.
Awesome. Yeah. Well, we will talk to you guys next time on the Power Eastern Oregon podcast.